So in our field of medicine, we always try to do something new, something better. So by introducing the robotic knee replacement, we have introduced a newer and a better form of knee replacement. So if we compare it from traditional, it is the differences between the traditional and the robotic will be: number one, again, the accuracy of robotic knee replacement is better. The positioning of the implants and the balance of the knee is better restored with the robotic knee replacement. Number two, the trauma to the tissues, the surgical trauma is less with robotic knee replacement. Consequently, the blood loss is also less in a robotic knee replacement. And if you compare between traditional versus robotic knee replacement, the recovery time is less in robotic knee replacement. So overall, we have been able to improve our surgical results and improve the surgical experience of the patients after introducing robotic knee replacement.